Welcome everyone. So this is again our Friday seminar, and today we're very delighted to have Megan Wier to give the talk. And Megan is the director of the program on health, equity, sustainability in the environmental health branch of San Francisco Department of Public Health. She and her team work with local communities and government agencies to develop and apply innovative approaches to using health data and evidence to inform safe, sustainable, and equitable transportation and land use planning decisions in San Francisco. Ms. Wier, who chairs the San Francisco Citywide Vision Zero Task Force. So you all probably already heard that Vision Zero and to reduce traffic crashes in cities, and also oversees a comprehensive collaborative data system in support of evaluation, surveillance, monitoring, and analysis of San Francisco's data-driven, evidence-based transportation injury prevention initiatives. Ms. Wier has an MPH in epidemiology and biostatistics from UC Berkeley, and a BA in sociology and women's studies from the University of Michigan. So go blue. Okay, yeah, we have a student from Michigan. Okay, welcome and thank you.
Thank you so much. Thank you so much, Michael, for the opportunity to be here. It's really an honor, and so excited to be able to be here today and to share some of the work that we're doing in San Francisco to eliminate traffic deaths, and also look forward to the discussion at the end. The way that I have structured this presentation is kind of in like two chunks. The first part, I'll be just talking more about Vision Zero more broadly in our initiative to eliminate traffic fatalities in San Francisco, as well as reduce severe injuries. And the hat that I wear is our city's task force co-chair. So sharing more about our city's action strategy and what we've been doing to eliminate deaths on our city streets. And then I'll pause for a minute and then segue into the public health role in particular in Vision Zero and some of the comprehensive data systems that we've been developing to help inform Vision Zero as a data-driven, evidence-based policy. So in San Francisco, the health department we're actually the only co-chair of Vision Zero in the country that we know of to date. And we really focus a lot on traffic, injury, and death as a public health problem in San Francisco. Historically, we've had about 30 fatalities a year on city streets and another approximately 500 people hospitalized with severe injuries annually in our public hospital, with estimated medical costs alone at about $35 million. And what this means is that on average, about every 17 hours, one of our city's trauma surgeons is responding to a severe injury on our streets. And that accounts for about half of the traumatic injuries seen at our hospital, which was a surprise even to our trauma surgeons that the traumatic injuries in San Francisco are about half of them are on our transportation system. Vision Zero is really a really pretty profound paradigm shift with respect to traffic safety in the United States. And this is a slide from the Vision Zero network that on the left depicts the more traditional approach to traffic safety, and on the right, a Vision Zero approach. And so traditionally, traffic deaths have really been viewed as pretty much an inevitable outcome on our transportation system, whereas from a Vision Zero perspective, they're fundamentally and critically preventable. And traditionally, we've also tried to focus on like how can we perfect human behavior, whereas from a Vision Zero approach, we anticipate that people are going to make mistakes, and how do we design a system that ensures that the consequence of a mistake, which can be made by a child or anyone in our transportation system, is not death. Traditionally, traffic safety is focused on preventing collisions, whereas Vision Zero focuses on preventing the most severe outcomes of collisions. So again, the severe and fatal crashes traditionally is, again, focusing on individual responsibility. So how do we each take care of ourselves independently on the system as opposed to a systems approach. How do we create a safe system that protects even the most vulnerable people that are using it? And finally, that saving lives is something that's just too expensive for us to implement in a transportation system versus saving lives is something we really can't afford not to do. San Francisco was the second city in the country to adopt the Vision Zero policy, very, very briefly behind New York City, and that was in 2014. Since then, now over 40 cities in the country have adopted Vision Zero policies, and that's really a growing list of cities. This chart depicts trends and fatalities in San Francisco in recent years. Vision Zero, again, was adopted in 2014. In 2017, we saw the least deadly year of traffic deaths in San Francisco streets in our recorded history of over 100 years. Sorry, just going to get you back there. There we go. In 2018 was the second least deadly year in history. Last year, we did see an increase, most notably in people who were killed while in motor vehicles in San Francisco. We are still below Vision Zero levels with respect to fatalities, but we know we have so much more work to do to realize our goal. And this is really in a context that many cities are facing, where we are seeing growing populations, growing circulating vehicle trips, including from services like Uber and Lyft on our city streets, and also challenges including affordable housing prices and other issues that are really impacting people's risk and vulnerability to traffic deaths. So I co-chair our city's Vision Zero task force. This complex slide, on the right, we have the many city agencies that I have the honor of working with on a daily basis. So it includes our transportation agency, our public works department, the fire department, our police department, as well as our city hospital. We work closely with advocacy groups, including Walk San Francisco and the San Francisco Bicycle Coalition. We meet as a city task force in City Hall on a quarterly basis. We also are accountable to Vision Zero Committee of our Transportation Authority Board. And we're organized by safe streets. So really the tip of the Vision Zero spirit is how can we design safe streets that protect people, safe people. So that includes our education and enforcement initiatives, increasingly focusing on safe vehicles. So how do we ensure vehicle technology and vehicles are designed to support safety? And then overarching data systems, as well as our legislative agenda, which I'll get into more in this presentation. Vision Zero, the core principles of Vision Zero are really clearly aligned with principles of public health. So a focus on saving lives, a focus on prevention, a focus on equity, so ensuring that everyone is protected in our transportation system, and also a focus on speed, because speed is really the leading predictor of whether or not someone survives a crash. And again, as I mentioned, focusing on initiatives within the buckets of safety. And this is a diagram really depicting the relationship between safety and survival, and why it is such a fundamental focus for Vision Zero. Someone's hit at 20 miles per hour, you have a 90% likelihood of survival, whereas at 40 miles per hour, you have 20%. And this relationship is even more sensitive for seniors. So at any given speed, seniors are even more vulnerable to injury. I'll pause.
I think I muted the, probably some remote participant make a lot of noise.
Okay.
I muted that.
Okay, thank you. We have, in 2019, we released our third Vision Zero action strategy. Vision Zero in San Francisco is also really focused a lot on a broad stakeholder engagement from the city family as well as community stakeholders to inform the actions that we're implementing to save lives. In addition to extensive community engagement and workshops, we also have been working to review the international evidence with respect to best practice in traffic safety. This is our framework for Vision Zero, and I'm going to just get a little bit deeper into each of these triangles. So we have strategic actions, which is what's actionable by the city, transformative policies that we're advancing at the state level, as well as a focus on complementary goals and initiatives that we're working to coordinate with. And underlying all that is really a focus on equity. As we learn more about Vision Zero and people who are disproportionately impacted by injury and death on our streets, we know that we will not realize Vision Zero if we don't lead with and focus on equity and implementing all of these initiatives. So here I just wanted to highlight for everyone some examples of the actions in our Vision Zero strategy. And also all of this information is available on our visionzerosf.org website if you're interested in getting more into the weeds. So for safe streets, examples of actions include the city's commitments to installing 8 miles of bike lanes, transit red carpet lanes, and sidewalk widening across San Francisco, completing near-term improvements on the high injury network. So we've developed a high injury network which really shows where severe and fatal crashes are concentrated, and that is the roadmap that the city uses to employ engineering improvements. A big focus of Vision Zero has also been how can project delivery timelines be shortened. So as we're increasing the attention and political will and focus on saving lives, how do we get those improvements in the ground as quickly as possible? And then also, as we were discussing earlier, eliminating private vehicles on Market Street is another Vision Zero strategy that the city was excited to celebrate a couple weeks ago. So things like closures for private vehicles are another really important way to protect people walking and biking using transit on those streets. For safe people, again, this is really focusing on the engineering and education programs that are important complements to Vision Zero, focusing on campaigns that look at left turns being disproportionately involved in severe and fatal crashes, focusing on motorcycle riders, really deepening our work on multilingual access and engaging with people that might not more routinely show up to the usual community meeting at City Hall, including seniors, people with disabilities. And we also have, our police department has a focus on the 5 campaign, where they focus their traffic citations on the 5 most dangerous driving behaviors that contribute to crashes, injury crashes in San Francisco. And that's speeding, red light running, failure to yield while turning, failure to yield to pedestrian, and stop sign running. So that's a real focus of our police. And then also increasingly, as I mentioned, safe vehicles. So San Francisco, of course, is a demonstration site for a lot of what's happening with respect to autonomous vehicles in the country. So working to inform San Francisco autonomous vehicle policy from a Vision Zero lens with respect to what is the opportunity for saving lives, particularly for our most vulnerable road users. And also working to help evaluate emerging mobility pilots on devices such as e-scooters, again, with an eye to how can we just ensure safety for people. And finally, I'm also the lead on data systems. So I'm going to talk a little bit more about our high injury network and how we're bringing together police and hospital and other data sources to ensure that we have the most comprehensive injury data to inform our initiatives, and issuing regular reports on severe injuries and other factors so we know how we're doing. Next, I'm going to talk about our transformative policies and complementary goals. So that was really like a high-level overview of what can a city do with respect to actions towards saving lives. But we also have a transformative policy agenda, which really calls out where are there really important evidence-based, data-driven, high-impact state legislative opportunities that, if implemented, we know would move the needle on Vision Zero. And that's really a focus of where San Francisco's state legislative work is. And that includes urban speed limit setting. So how do we lower speed speeds in areas given the importance of speed to saving lives. Automated enforcement, including automated speed enforcement. Congestion pricing, which is also currently being studied in San Francisco, and also local regulation of transportation network companies for Uber and Lyft. And all these policies really intersect with slowing vehicle speeds as well as reducing the vehicle miles traveled on our streets. Simultaneously, how we are now 6 years into Vision Zero, and when we look at the state of what do we need to have safe, healthy, sustainable, and equitable cities, there are clear policy intersections with other issues like climate change, which also really needs to see significant increases in walking and biking and transit and reductions in private vehicle miles traveled. With things like land use and housing decisions, is affordable housing located so that people can take those more sustainable trips? So how we are working more and more at how can Vision Zero be at the table for those policy discussions? How can we work together with those initiatives and think about funding, communication, and other important things that we can do better together to realize these goals? And finally, the fundamental underlying foundation is how do we focus and elevate equity in these discussions? So doing so through things like community engagement, but also prioritization of improvements in low-income communities and communities of concern, considering equity impacts with respect to policies, and better engaging communities and ensuring that we have the data that can help us elevate equity. So as I said earlier, we know we won't realize Vision Zero if we don't address the current inequities in our transportation system. On the left of this slide is our Vision Zero high injury network. It's our 13% of city streets where 75% of severe and fatal crashes are concentrated. That's where the city is really investing a lot of our resources to save lives. But when we look at underlying those blue lines at the orangish, peachish areas, those are the areas where we have higher concentrations of low-income communities, communities of color, seniors, and people with disabilities. And we see that our high injury network is really disproportionately represented in those same communities. So through targeting our investments on the high injury network, we're also helping address some of the historic underinvestment in those same areas. When we look at trends with respect to severe injuries and deaths, you can also see in San Francisco that people walking are really disproportionately comprise who is dying. So annually, about 2/3 of our fatalities are people walking, and about half of those people are seniors, age 65 and older. We also see cyclists and motorcyclists, again, on more vulnerable roads, are more represented in fatalities in San Francisco. And we've also seen higher proportions of people who are homeless being killed on our city streets. So in 2018, a fifth of the fatalities were people without housing, which is still less than 2% of the city population. And so these are challenges that are, of course, are regional and state challenges. And when thinking about safe systems is, I think, also an opportunity for us to think as government officials, how can we better partner with other city agencies to address the intersection of transportation safety and our housing crisis. This is my Zen tree picture where I'm going to take a break and segue, because trees make me calm, and I like this picture. But I just wanted to stop here before segueing into
East Coast picture. It's not in there. This picture is from the East Coast, right?
Oh,
the trees.
Probably.
Not redwood trees.
Yep, you're right. I should probably update the major. But I like all of these and others. So I just wanted to see if people have any questions at this point with respect to the larger initiative before I get into, I'm going to get into the weeds on a lot of the data next. Yeah.
I'm curious how you engage with the TNCs and their response to your policy?
Yeah, sure. I mean, with respect to TNCs, that's definitely an area that a lot of people have elevated, through our community engagement process. We, in the current action strategy, we are working. One of the actions is to develop like an education campaign that engages TNCs more. Honestly, the TNCs are more engaged with the SFMTA on a whole host of issues that Uber and Lyft and San Francisco are working on. I think one thing that's come up to us that I'm interested in is what are opportunities to engage with passengers of TNCs around opportunities as you're exiting and entering vehicles, etc. Because a lot of what we see in San Francisco is a lot of TNC drivers, but also a lot of people are not from San Francisco, and so as we have a lot of innovative pilots and other things happening in the city, I think there's opportunity, for people using TNCs to also help with that. Yeah.
On point, are the the Uber Lyft drivers overrepresented in fatalities and serious injuries?
We just added so currently that data is not collected across the state on crash reporting forms. We added a variable looking at whether or not a Uber or Lyft was involved in a fatality. Last year, none of the drivers that were at fault were Uber and Lyft drivers, but we were just really starting to add that data more.
That's only at fault. Were they involved also?
Yeah, there are people that were involved in crashes. Yeah. And as I mentioned for our state regulatory agenda, so currently San Francisco doesn't have any regulatory authority, of course, over Uber and Lyft. So better understanding what opportunities there are for that regulatory authority is part of our yeah.
There's like a health and safety aspect for congestion pricing for TNCs. Is that part of the congestion pricing?
Yeah, I mean, I think with congestion pricing, it's not just TNC, it's really like all, circulating vehicles on city streets. And so San Francisco is studying congestion pricing again. I actually have been at the city long enough where I was involved in the 2009 study of congestion pricing, and we conducted a health impact assessment looking at how model changes in traffic volume could benefit pedestrian injuries. And there is a strong relationship between circulating traffic and injuries. So I think we're really interested in what are opportunities with congestion pricing to reduce vehicle miles traveled and improve safety, both through the reductions in VMT, but also through revenue that could be invested in safety improvements as well. Yeah.
Hi, so Molly Doug too, and me and Michael are actually on that SFCTA congestion pricing project a little bit. We have an SP1 project that is heading to complement the SFCTA congestion pricing study with an equity analysis. So our work is right now starting to determine what mitigation strategies can make a congestion pricing strategy more equitable, and then Michael will come in with some quantitative analysis on how you can apply what we can expect with applying those strategies.
That's great to hear.
Spring and summer. Yeah, I don't want to overpromise, but I think spring and summer.
I'm on the technical advisory committee, so I'll look forward to it. Yeah.
But we're not like directly working for San Francisco with the SB1 project.
Okay. Yeah. That sounds good.
We need from the FSTA. We need their data.
Yeah, we do. We're still waiting on their data. They were supposed to do their modeling, so these things always take long. That's why I can't promise that it's going to be done.
I understand. Are there any other questions?
I have a question about the financial.
Yeah.
Like it seems for a large, very wealthy city like San Francisco, this could be a really easier project to take on money, but smaller, less wealthy jurisdiction, like, how much have y'all had to spend, and what are other folks doing?
I feel like that's always a question that's like impossible, question to answer of like how much does it cost. I think it's been a hybrid of, a lot of what, a hybrid of additional resources, but also, changing practice. So my goal as co-lead of Vision Zero is like, how do we just make this how, this is the lens through which investments are made. This is how things are prioritized. So I think, but for something like Vision Zero, communication and education is actually really critical. If you have a goal that is accountable to the mayor, and the board of supervisors, it does require resources to be able to communicate and coordinate on those issues, and also thinking about education and the culture change that is required. We're really fortunate that the San Francisco Municipal Transportation Agency funds a Vision Zero epidemiologist full time on my team that is part of what I'm going to talk about next. That's seated at SF General Hospital and is really dedicated to how to make sure that we have the best available data. But for smaller jurisdictions, I think, just really getting started, even with fatality, monitoring, and how you bring together a group, a multidisciplinary group, to start understanding, those patterns and thinking about, what strategic investments could help both with fatalities and also severe injuries. And there's great online resources like TIMS and, and other resources for that type of data. So I think that there's a lot of incremental steps that cities can take, absent from the top leadership and resource investment to really advancing a safe system. And then also I would be horribly remiss without mentioning the importance of, community stakeholders and advocates, and really engaging with the community so that there's a policy that's really responsive to concerns that people are seeing.
Make a quick announcement.
Yeah.
For those of you who listen online, I have muted all of you because your mic interfere with here, and we hear the noise from you. But towards the end, I mute all of you, and you can ask questions. People watching.
I'm going to segue into the next part of the presentation. So now I'm going to talk a little more around just kind of the unique role of public health within Vision Zero and some of our work on creating comprehensive data systems. So this table really talks about what are the many ways in which I would encourage all of you to partner, with public health on transportation-related projects in general. But specifically for Vision Zero, we co-chair the citywide task force. We also are the lead for data systems, so I have a team of epidemiologists and data analysts working on this. Public health also has a lot of great relationships with community stakeholders for a whole range of initiatives, and has had a lead role on community engagement and education. Also, with respect to policy, we work closely with the city family around the Vision Zero policy issues, and our doctors have been really critical voices and providing testimony and speaking to the media with respect to change. And then also public health, core to public health is equity, so really working to elevate equity within the policy. Our Vision Zero Injury Prevention Research Collaborative is a partnership between my team and the Department of Public Health and trauma surgeons, emergency physicians, and other medical professionals at Zuckerberg San Francisco General Hospital. And we're in a really privileged position in which the hospital is our city's only level 1 trauma center for both the city and the county. And so that means really that all the most severely injured patients are transported to the hospital for care. And the hospital is part of the health department, and that has been really helpful for us with respect to establishing data sharing and other partnership agreements. And so the trauma hospital is a 24/7 operation, and there's a whole host of benefits of being seen and treated at a trauma center that results ultimately in improvements in survival. So as I mentioned earlier, we have a Vision Zero epidemiologist funded by the SFMTA. One of the first things our epidemiologist did was work to create a traffic fatality protocol. And all these resources are on our website for people who are interested. But even something that is as straightforward as a traffic fatality was not. And when I started in San Francisco, there would be public hearings, and 3 agencies would come with 3 different numbers with respect to fatalities in San Francisco. And so having this initiative and this resource really helped bring everybody to the table to get on the same page about what are we talking about, what is the data. We now, our epidemiologist now synthesizes the numbers and maps them and posts them on a monthly basis so that everybody is on the same page with respect to what's happening with respect to fatalities. And then revisits and updates the protocol as needed. But in addition to monitoring traffic fatalities, when we also started this work, there's been historic work that was conducted at San Francisco General Hospital that found underreporting in pedestrian injuries based on police data being the primary data source that people rely on for understanding injuries in California and most of the country. And so we worked to develop a linked data system that would link police and hospital records to have more comprehensive injury surveillance. While police data provides really critical information about what happened at the time of the crash, including vehicle movements and crash characteristics, the hospital data can bring more refined assessment of injury severity and other health factors regarding the person who was injured that can really help us understand both the burden of injury and the characteristics of the people that are being injured. And so our first pilot linkage brought together police data, hospital data, and then we also got ambulance data because, well, a lot of historic record linkages have looked at the 2 data sources. We knew that for San Francisco, we also really needed the location information because we want this data to be useful for engineers who don't want to know what happened at a zip code level. They want to know what happened at a specific intersection or along a particular corridor. And our ambulance data is currently the best way to get that for a hospital record. And so in addition to, this slide, I wanted to talk a little bit more about injury severity. And so when police report to the scene of a crash and are determining injury severity to complete a form, they're really using their best assessment of a visual assessment of an injury. So severe injury can be anything from a broken bone to severe laceration to unconsciousness to abdominal injuries. But what we've seen is ultimately when someone gets to the hospital and the longer term outcome, that initial assessment of severity can be ultimately a less severe or a much more severe injury. And so in linking to the hospital data, we're able to get clinical information from the hospital record, including both whether or not someone was severely injured enough to be admitted to the hospital, but also what's called an injury severity score, which is used, it's an aggregate measure of degree of injury severity based on a bunch of different body parts. This is a whole other discipline that has limitations, but ultimately the injury severity score has been found to correlate with survival and how severely someone is injured. So we completed the 3 years of record linkage, and when we looked at the question of who is transported to the hospital by an ambulance but was not in police reports, we found 39% of severely injured bicyclists in our data set, close to a quarter of pedestrians, and 28% of severely injured people in vehicles were not in our police data, but were hospitalized. And so when we're thinking about, that from a data-driven, evidence-based perspective, we feel like it's really important to do this type of linkage and to think about how can we bring more comprehensive data. The past the past analysis had also found underreporting in African American populations, which when people ask us why do we see underreporting these data sets, there's concern at a number of different levels. But one could be, some communities may be less likely to report an injury based on past experiences or concerns with interacting with the police. It's notable that our bicyclists are also seeing the highest underreporting in hospital records. So thinking about, solo cyclist crashes where someone may be injured and not necessarily call the police, but be, immediately transported to the hospital for treatment. So with respect to why is there underreporting, there's a whole probably host of factors that are contributing to underreporting. But as we move forward with a data-driven, evidence-based policy, we are working hard to bring together the most complete data that we have to inform our initiatives. Another thing that we've done, if you are really into data that I encourage you to check out, is our Transbase sf.gov.org dashboard. And sorry, that little black box is cutting it up. But this is an interactive dashboard that my team developed that brings together all of the police reported crashes in San Francisco and allows you to analyze them at any geographic level of specificity that you're interested in. So it both maps it, but it also creates graphs, queries, data exports, and other things that people can use. So if you're interested in an intersection, a neighborhood, or the entire city, this is a that
I muted him and then he turned.
This is a resource. Thank you so much, Michael, for taking care of that. And so again, with Vision Zero, we're really focused on ensuring data is transparent and accessible. So this is something that both is available to the public, but also to our city traffic engineers who use routinely for corridor level analyses. So when we completed that record linkage, one of the first things that we did was updated our high injury network. And so we were, to our knowledge, the first in the country to use both police and hospital data to identify the corridors that are contributing the most to severe and fatal crashes in San Francisco. So we were able to bring in the data from the hospital, include crashes not reported to the police department, and really focus the high injury network on those crashes.
Yeah, I have a question. So
Yeah.
the hospital, when a pedestrian or biker goes to the hospital know where the injury occurred, or based on the recollection of the.
Yeah, and that's where the ambulance data was really important. So we only know where the injury occurred for people that were transported by ambulance, and that's a limitation and something that I think an opportunity for research and further collaboration is thinking about how could we better capture location of injury data in hospital records for people who aren't transported by ambulance, but we were able to use a subset.
I was wondering, among the 39% of underreporting, how much are with ambulance and how much are without ambulance?
So this is all ambulance.
Oh,
This is a statistic just for the ambulance transported. So, yeah. Which is striking because, again, that's like people who aren't reported that are severely enough to be taken in an ambulance that are not in the record. So this is our high injury network, and the network really captures similar proportions by mode, and then also for internal analysis, we have different layers of the network that are just pedestrian focused or cyclist focused or vehicle focused that our engineers can use to drill down deeper. we already talked about this earlier, but again, overlaying our Industry network with our communities of concern so that we can better understand those intersections and then target improvements. Another thing that we were able to do with the hospital data was, particularly given that seniors comprise about half of our pedestrian fatalities and only 15% of our city's population, and we also know that people with disabilities are also more vulnerable. We've developed another tool to look more closely at where are seniors and people with disabilities being injured, but then also conducted a survey with a broad range of community stakeholders to better understand what are popular destinations for those communities to travel to. And so we brought in senior centers, public libraries, meal programs, high frequency paratransit stops, and other destinations into this map. And now this map is being used to inform, so we have the Industry network, but where are there opportunities to inform other locations where more vulnerable populations are traveling for traffic calming or other types of improvements. So what we really try to do is better understand where there are vulnerabilities, and then how can we bring in data layers that can help us understand at a high level what could be done more to protect populations. This, for the Industry network and this map and other map that uses the police and hospital aggregate data, we work closely with our city attorney and our DPH privacy office to review to ensure that data is being aggregated and presented in a way that protects patient privacy, because that's one of the biggest, fundamentally we must protect patient privacy. So advancing this work has been really critical for us to work through those processes to ensure that anything that we share is helpful, but also is ensuring that privacy. So the other thing I wanted to share is that I think these types of collaborations also really help provide a lot of other opportunities, help bring the right people to the table so that as other emerging issues arise, you have the relationships that can help respond to them. And so while we were working to create this linked data system and collaborating with our colleagues at the General Hospital on Vision Zero, in 2018, e-scooters were launched in San Francisco and many other cities around the country. And everybody, we received a lot of questions with respect to safety concerns. And because it was a new mobility mode, there wasn't a variable in the hospital data that said like e-scooter involved. And so we were able to sit down with the police department, our trauma surgeons, our emergency room physicians, and other colleagues to operationalize like what would we actually want to collect in hospital records so we could start monitoring these injuries and begin to answer these questions. And so through the amazing work of the people that oversee our trauma registry, they were amenable to adding 3 new variables to capture different vehicle types that are being seen on city streets that are now abstracted from medical records for injuries. We also added a question regarding whether or not it was a sharing technology as well as anticipating autonomous vehicles. Then we worked to document this methodology and shared it with our colleagues around the country, and also conducted analyses to inform the pilot evaluation of the permit program. But we're also really excited that as all this was happening, this was definitely a popular question around the country, and we were able to work with colleagues nationally to inform new guidance that will be adopted later this year, so that there's now going to be standardized coding for hospitals across the country in the ICD or International Classification of Disease guidance, so that moving forward, we'll be able to better answer these questions. So I just wanted to conclude my presentation with the statement that while I'm an epidemiologist and data enthusiast, data is critical, but it's never sufficient. And so just really wanted to thank the many people who I have the honor of working with, from the city family, the leadership of our mayor, the board of supervisors, state legislators, advocates, city departments, and many other people that are really helping make Vision Zero possible. I look forward to discussing and hope that it's something that you'll get involved into, because it's something that I think is critical really to our quality of life on an everyday basis.
We'll have a few questions, and then I'll unmute the people. I hope we're all
Yeah.
Thank you for your presentation. I'm curious if you have evaluations for your programs, not just infrastructure, but you talked a lot about educational outreach and things like that. How do you evaluate those?
Sure. So, like we actually just completed an evaluation of. We have a lot going on, but on the educational side, we've had a few high visibility enforcement campaigns that are educational campaigns linked with high visibility enforcement, which are among the most effective from a traffic safety perspective. And so my team has been involved in helping evaluate those. A recent campaign that was conducted that we led the evaluation for was a safe speeds campaign. So from that high entry network, we identified the streets where speeding was contributing to crashes involving pedestrians and cyclists. The SFPD had targeted enforcement on those corridors, along with a community engagement and education campaign, both targeted on the corridors and citywide. And we evaluated that campaign using people went out into the street and took speed measurements before, during, and after the campaign to assess people's speed. And we found that right before the campaign, there was evidence of reductions in speeding, and that was we think somewhat of a halo effect with respect to signage that was put up, announcing the campaign. During the campaign, we saw the most significant increases in speed, and then a week after the campaign, there was some effects, but there were not sustained effects over time. And so that is one of the reasons why automated speed enforcement is one of our lead policy focuses of our state policy agenda, because we know that those types of campaigns are very effective while they're happening, but are not sustained over time. So there is quite a bit of evaluation that's also.
Do you guys publish those evaluations?
That evaluation is available online. We have published, like the capacity for publishing.
I mean, just put it out there.
Yeah, but I'd be happy to share that link to that evaluation. We also evaluated, we had a similar campaign for driver yielding, another campaign for distracted driving. So for those types of investments, we do evaluate.
There's a complicated relationship between congestion and speed, and you have both of those as a priority, reducing congestion and reducing speed. And so how do you think you can achieve that?
Reducing congestion was not a priority. It's reducing vehicle miles traveled. So I know that there's policies that are
not your priority.
Yeah.
Maybe the larger cities' priority to reduce congestion.
Yeah.
So, and then how do you think you could balance that changing congestion with speed?
Right. I mean, I think for me, what in working with Vision Zero over time, something that's become more and more clear is the critical role of public transit. In all these discussions is a really important carrot to a lot of the difficult changes that we need to make. So I think with policies like congestion pricing, having like a reliable public transit system that people can transition to is a really critical piece of that. So not just like slowing, or speeding everyone up, but having that transition out of vehicles into
Megan, London implemented this congestion pricing, code pricing a couple of years back. And they reported the increase of vehicle speed, travel speed, and also increase of transit ridership. I was wondering if you're aware that then health study look at whether the fatal crashes or the injuries have increased or decreased during that period.
Yeah, London evaluated injuries and saw decreases in injuries after the introduction of congestion pricing. But I think also to your point, the what are safe urban speed limits is another really critical part of that discussion. So as how do we ensure a basic level of speed that's protective of human life, and that's really 20 miles per hour is much more protective than what we're currently seeing on the city streets.
We on the back.
The conversation about speeds and congestion, that's one part of why fatalities and the injuries might be occurring. But how about like out of all the cases that you received, is there a mapping of whose fault was it? And then is there one part of the program where you look at maybe outreach and education, where it's the mistake of the pedestrian or the bicyclist? And then how many of those cases, is there a general idea of who's at fault in general, and what could be done about cases where it's not speed or it's not vehicles that are at fault?
I mean, I think the thing about speed is even if someone isn't speeding, if speeds are slower, it protects everyone. It protects everyone regardless of fault. Right. If a driver is going slower, you have more time to react, and if you do collide with someone, you're less likely to kill them. So I think, while there is a primary collision factor, I think arguably in every fatal crash, the speed of the vehicle is a factor in whether and how severely someone is injured. With respect to fault, that is something that is routinely tracked and recorded. With respect to like pedestrian fatalities, year after year, it is disproportionately driver at fault that we see in our fatalities. But really, from a Vision Zero perspective, we're focusing more on how do we create a safer system whereby speeding is prevented. So with respect to the educational questions, we have the speed campaign, we have the driver yielding campaign. We're really we have a Safe Streets for Seniors program that engages with seniors and senior facilities, both around traffic safety more broadly, and then also on how to just get engaged with Vision Zero around where improvements are prioritized in the city. We also have the motorcycle safety campaign. We were I think the first city in the country to have a motorcycle safety campaign, which I think of from a public health is like a harm reduction approach. Riding a motorcycle inherently involves a level of risk, but how do we engage with people who ride motorcycles around like what are safe ways to ride? And that's been a really popular program. It was like when the training was launched, it was immediately like oversubscribed. And so I think as we're seeing these emerging mobility shifts, like opportunities for that space, we've also been engaging with the e-scooter permitting program around, like what are opportunities for education and that kind of thing. So education is, and I think more importantly, culture change is a really critical component of Vision Zero. But I think, again, kind of back to a safe systems approach, understanding that no matter how much education we do, people are going to make mistakes. And that includes our children, that includes, and mistake in our transportation system can be getting stuck in, not being able to cross the street fast enough at time, and, being against the light. And so how do we create a kinder system that prioritizes human life?
You talked about bringing the speeds down. But we're in California and there's basically restrictions on how low the speeds can be set in our, so could you expand on that? Maybe there's laws that the speed has to be set at the 85th percentile, and residential speeds can't be lower than 20 miles per hour and 25 miles per hour, and yet you're talking about 20 miles per hour. So
sure, that's a great point, Peter, in that I had the honor of being in the State Bureau Traffic Fatalities Task Force that recently released their report, so people around the table are interested in, in these issues, looking at, what are the state setting speeds based on the 85th percentile, which really can actually contribute to increases in speed limits, given how fast, setting speed limits essentially based on how fast vehicles are traveling.
but making the driver decide the speed limit, which is
Yes,
it's not
exactly.
taking into account
Letting
the
the
neighborhood
speeders
and the,
decide this.
yeah,
Exactly.
yeah.
So,
And
I
more
think,
people are dying outside the car in San Francisco than inside. So
Yeah.
why
I
are the
think-
people inside setting the speed limit? I'm sorry.
Great point, Peter.
Well, okay.
And so I think it's, how can we, that report I think was really helpful in
I interrupted you. I'm sorry.
detailing
No,
the, detailing the
But what
certain
report? I'm sorry.
limitations. And then what are opportunities to use other criteria that are consistent with saving lives and protecting most vulnerable. So, opportunities around looking at speed limits on high injury networks, looking at speed limits near senior centers, and how can we set those speed limits to be more protective?
Do you have an answer? I mean, how do we do it?
I mean, I think that it requires. I mean, that's a state legislative question. But I think that there's a growing body of strong research, and I'm confident that we'll get there.
Megan, I have a question about your high injury network. So is this just purely based on the number of injuries
It is.
happening?
It's based on severe and fatal injuries.
Okay,
Yeah.
so I'm fatal. But if you look at some of the map, it's, for example, downtown just simply have a lot more cars, a lot of pedestrians. So the link may not be riskier or.
It's not about risk, it's about saving lives. And so we need to make conditions safer where the most people are dying or being severely injured.
But the marginal sort of benefit for some link may not be that great. So for example, if you put a lot of money in a busy one, and then the injury can be fatality can be reduced from 8 to 7, while there's some others can be from, let's say, 3 to 0. And although that 3 is not outnumbered that the 8, but the marginal improvement
Well,
is
the
much
city is
bigger.
investing in the high injury network overall. So it's kind of our roadmap of where everything, where the vast majority of injuries are concentrated, and then there's a number of factors that impact on, where and when and how, the city is investing. So I think like those types of cost benefits would probably be really a context specific issue.
What my point is that you need to look at the marginal, sort of on the margin, and if even you have the highest number, your improvement for that may not be on the margin, may not be better than a lower number one. So you need to weight the sort of the kind of the occurrence by the population or by the intensity of
When we look at weighting by population, we can often disappear. Weighting. My main concern about weighting by population is that you're essentially normalizing the status quo of injury across the network. And some of our areas where we have like the highest number of people walking are the areas that we have the highest concentrations of low-income communities and communities of color, people that don't own cars. And so saying just by virtue of having the most sustainable transportation behavior in the city, and that more people in your community die is not something that I think is ethically allowable.
That's another layer of, basically that's an equity issue, right?
Yes,
So
it sure is.
It's not just based on the number of crashes. I think it's a point is that when I teach my undergrad students, look at which mode are safer, and if you look at the number of fatalities or accidents, the highway is it's like 39,000 a year and so forth. But if you normalize by the vehicle miles traveled, the highway is not as dangerous as say the trains, because the railroad crossings have could be have a lot more accidents, although the sheer number is small, but they just have so fewer VMT or passengers. But for cars, just so many drivers and so many VMT. So if you don't normalize, you could have some link appear to be really dangerous, but actually they may not be as dangerous as some other links without this.
I mean, I think there's a lot of pros and cons of different approaches to normalization. And our approach is really where is the burden of injury. And what I've seen in other, historically with respect to normalization is lower income communities where we have a lot of people walking, people saying, well, there's a lot of people walking there. Like that's why we have so many fatalities. And so that being, that has been historically just kind of a way to normalize, unacceptably high rates of death. So I think at the end of the day, how can we invest to save the most lives?
You mentioned autonomous vehicles, and I work on a project looking at trying to predict pathways of things like pedestrians into roadways using LiDAR and other sensing technologies.
Yeah.
And then in the vehicle side itself, it also has a similar kind of sensing and processing requirement. And then you mentioned speed, and obviously you can govern speed of autonomous vehicles externally as a potential regulatory step. And so then you really got a lot of insertion, technological insertion and requirements for that interaction as a potential solution for Vision Zero. And it just seems like an unbelievably complicated arena that is created. I mean, and how do you think you can manage that? I mean, that's just another layer upon equity and all of that.
It's such exciting times. There's anything really boring happening. I mean, I think the opportunity for Vision Zero is with autonomous vehicles is thinking about, particularly for San Francisco, like who's being, severely injured in our streets and killed, and are these technologies, which are often discussed as silver bullets for safety, addressing those factors. And what we see in San Francisco is it's people that are walking on our streets, it's seniors, it's people without housing who may or may not, have technology. And so what are these vehicles doing to address those crash patterns? And I think speed, are there opportunities for autonomous vehicles to be role models of speed observance, of new, lower speed limits? Are there, what are the innovations with respect to pedestrian and cyclist detection, which to my current understanding is not part of, the requirements for AV technologies in this country. And so I think thinking about, as we're talking about AVs and opportunities for safety, being very specific about who's actually, dying and being injured and matrixing them back to those technological.
Yeah, and who's sitting in the back enjoying their latte while their vehicle wreaks havoc.
And not to mention circulating vehicle miles traveled.
Yeah.
Last question. Yeah. All right.
Thanks. Yeah, great presentation. Getting back to the data side of things really quickly, you mentioned how someone might be injured in a collision at the hospital without a police report. But I saw also that 7% of your data set were people that had a police report injury but were not at the hospital. Do you have any thoughts on what might happen there?
I mean, I think, and noting this is all speculation, but I think, sometimes people don't go to the hospital, don't go to the hospital because of, medical costs or, refuse treatment. So I think even, and then I think it also gets back to the severe injury, you know, the kind of variability of severe injury classification by the police department. So we definitely have like a lot of other questions that we, you know, looking forward to learning more about there.
All right, well, we want to thank the speaker again.